Hi, my name is Sophia Young, and over this past summer, I had the opportunity to work with Dr. Emily Becker-Hames, as well as Dr. Amanda Sanchez, on a few different projects related to helping clinicians employ evidence-based practices to improve youth mental health services. I spent most of my time doing coding for Project Respect, which stands for Revamping Evidence-Based Supports to Promote Effective, Culturally Responsive Treatment, the subject of this poster. Project Respect aims to understand how to best apply person-centered, culturally responsive adaptations to exposure-based cognitive behavioral therapy, or XCBT, for youth with OCD and anxiety. As you may know, there is a significant unmet need for effective mental health treatment, which is exacerbated for youth of color and lower-income youth. XCBT is considered the leading evidence-based practice for treating patients with anxiety and OCD. However, it was researched and developed on samples of predominantly white, middle, and upper-class patients, with limited considerations of what adaptations might be needed for youth of color and lower-income youth. We have increasing understanding that cultural and contextual factors greatly influence a patient's identity, their experiences with, and response to mental health interventions. To be maximally effective, XCBT likely should account for and be adapted to individual cultures and contexts. I am presenting here on formative pilot work that is part of the larger Project Respect study. This work involves a 3-year retrospective chart review of youth who received anxiety or OCD treatment through the Pediatric Anxiety Treatment Center at Hall Mercer, or PATCH, here in Philadelphia. The chart review consisted of 113 clients enrolled in PATCH between January of 2018 and July of 2021, with 3,099 patient sessions in total, and all of our data was recorded in REDCap. The process began with codebook creation, which happened before my arrival to the project and was guided by the Framework for Reporting Adaptations and Modifications Expanded, or FRAME model, which you can see in the upper right-hand corner of my presentation poster. The FRAME model is a framework that aims to document modifications to treatment strategies. After the codebook was created, we established initial reliability across coders before beginning formal coding. Of course, as coding went on, reliability had to be continuously ensured. As of the middle of this past summer, we were well within reliability with an average kappa of 0.735 and 93.4% agreement between coders. If you look to the middle, you can see an example of one of our coding sheets for each patient session. So our main goal was to learn what strategies clinicians are currently using. Then we coded for 24 discrete treatment strategies, which you can see listed in the model in the middle. These codes included direct XCBT strategies like cognitive restructuring and exposures, as well as whenever cultural and contextual factors were discussed, or therapists used case management strategies. During my time with the project, we coded 1,626 sessions. In total, we now have 67% of the sessions coded, and will continue to calculate Cohen's kappa and percent agreement to maintain reliability throughout the coding process. Once completed, we will use data from the coded charts to examine the relationship between what treatment strategies are used and treatment length, attendance, and dropout. The information gathered through coding is critical in helping us to determine which strategies are effective and not effective, which strategies need the most adaptations, and which adaptations clinicians are already naturally making. We will also integrate this data with information from concurrently conducted qualitative interviews with clinicians, youth, and parents to guide the development of a toolkit of strategies to improve the cultural responsiveness of services for youth with OCD, anxiety, and related disorders. This is especially important as there is a lack of structured guidance for clinicians on how to adapt evidence-based practices like XCBT, or which strategies should be used in different situations depending on a client's identity or background. Through this work, Project Respect aims to begin closing the gap in our current understanding of how to reduce inequities in youth mental health care and make it more person-centered and culturally responsive. Thank you for listening to my presentation.